welcome back. This is going to be our first segment
Thank you.
of this interview. Okay, now tell me how much all the services cost the clients.
Actually, home health services do not cost clients who have Medicare or Medicaid anything. However, for clients who have private insurance, in some cases, it's depending on the plans, the benefit plans they have with their insurance companies. Some of the plans are covered 100%. However, some of them they're required to pay, to have like a co-payment. So it all depends on whatever insurance plans the patients have.
I know you mentioned about Medicare, Medicaid patients or clients do not pay anything when it for the benefits or the services that are rendered by home health agencies to them. Um, do do the clients of Medicare clients or Medicaid clients, do they know that it doesn't cost them anything for this service?
Well, actually, again, it's not like it's free for every patient. We make sure we inform them, we let them know, prior to admitting them for home health. We always let them know if they're probably just Medicare or just Medicaid. We let them know their services are free and they're covered by either Medicare or Medicaid. And for the patients with private insurance, we also let them know if their plan requires them to have a co-payment or if it's going to be covered 100%, of course, by the insurance company. So we always inform the patients so they're aware of what, commitments they do have. There's no financial obligation, or if there is.
How would one qualify for Medicare covered home health services?
First of all, there must be a skilled need required. And again, the patient must be homebound. And it also should be something recommended by the patient's physician. The patient's doctor should recommend that for the patient.
Can you explain to me the meaning of homebound in home health?
Homebound with home health, well, as the client or the patient is not able to perform certain tasks based on their health status. Some patients are unable, they need help to be able to perform certain duties or to be able to get out of their homes. And however, Medicare does allow certain services like physician appointments or probably going to church and probably infrequent visits with family. That is also allowed.
Okay, if I should restate then what you just said, tell me if I'm wrong. For homebound, that the clients or the patients must stay at home. I mean, it's a requirement by Medicare
Yes,
that they must stay at
they
home,
must.
except in situation where they go to church or they go to visit family members or
Right.
when it's of necessity for them to go out. Is that right?
That's correct.
Now, tell me what services are provided by the home health agency.
Our home health agency does provide multiple services, of which include skilled nursing. And skilled nursing, we do have registered nurses, RNs, and LVNs. And these LVNs, they provide comprehensive nursing assessments, care, support, and educate the patient on their disease processes. So they educate them on what signs and symptoms they need to look out for, what complications to report to the doctors, and also to monitor their health and report any abnormalities to the doctors as well. And we also do have physical therapy. And these physical therapies, they assist with gait, muscle strengthening, coordination, balance, walking, and function. And we also do have occupational therapists, and they do rehabilitation to restore skills for activities of daily living, such as bathing, dressing, eating, and minor ADLs. And we also do have speech therapists, and the speech therapists assist the patient with language skills, the ability to swallow, and some patients who have memory problems, the speech therapists are able to help them with that. And we also have home health aides, and these aides, they're kind of like hands-on personal care, and to make sure the patient's hygiene and personal care needs are met. And these needs include bathing, dressing, feeding, cleaning, laundry, grooming, and light meal preparation sometimes, and light housekeeping as well. And another service that we do provide, we do have social workers as well. And depending on the social workers' assessment, they do provide information and help the clients to provide or arrange for certain community services that they might need, such as living arrangements, crisis management, and guidance with financial problems. We also provide wound care services. Sometimes you can have clients with certain complicated wounds or surgical wounds, and we have nurses that are trained to do that.
Okay. Who recommends these services for a client?
All services for a client are usually recommended by the physician. Again, however, the patient has, the right or the choice to request certain services. Again, but it must be approved or authorized by the doctor. So the patient could complain to her nurse, for instance, like, I'm having a hard time getting all my ADLs done, like bathing myself and dressing up, due to maybe age or the disease process. And then we shall communicate that to the doctor. Or the patient can call the doctor's office and place a complaint, and the doctor's office will send us the order to go ahead and provide the patient with such services. And then we do provide the services from there.
So in terms of the doctor, I know, like you said, it is the doctors that actually recommends for services. Are there any instances where some of your clients, your patients, would recommend your home health agency to other needy clients for services? Has that ever happened, where a patient has recommended your agency to another client?
Yes, we've had that happen a few times. That's why we strive for excellence with our employees. We make sure we encourage employees to do their best for their patients. So based on the care that a patient receives from the nurse and the agency, they refer, if they have maybe a friend or a family member who needs the services, who needs that care or help, they do give them our contact number, and when they call us, then we make sure they see their doctor, and the doctor sends us an order. We tell them to see their primary physician, who in turn recommends, sends the order for whatever services they need, and we go from there, and we provide them with those services.
Finally, let me ask you, do you really like your job?
Oh yeah, I do enjoy my job. I have fun with it, actually. I enjoy enjoy being able to be sometimes just make sure I get my job done right, and I'm strict with the policy and make sure all the company policies are being followed by all employees, and likewise we do follow the policies put in place by Medicare.
In case somebody is interested in having services performed by your agency, do you all have a number, or what number would they call?
Yes, they can call the office directly, and they can dial 972-429-1114, and somebody's going to be right there to assist them and answer any questions that they may have.
So this can only be done by telephone, or are there other means that they can contact you, or just by telephone?
No, we do. They can contact us by phone or by fax, which is 972-429-1113, or via email, which should be healingpoolcare@yahoo.com.
Well, Miss, thank you very much for your time, and I appreciate you so much for helping me going through this fact-finding interview, and you've been of help to me, and I'll let you know the result when I'm done with my MS accounting.
You're very welcome, and I wish you all the best in your educational and professional goals.
Thank you.
You're
Once
welcome.
again, I appreciate you.
You're welcome.